So our next session is Come Together Right Now, Navigating Food Insecurity, Mental Health, and the Psychosocial Burdens. Moderating this discussion is Karen Palmer. Now, Karen has a very long bio that I've had to take no offense. I did have to cut it a little bit so we could get through. Karen is a certified professional coach who supports clients in a wide range of fields, including business, media, nonprofit, education, and the arts. Karen worked for over 20 years as an assignment editor, producer, and senior producer at major news networks. And later she used that experience to collaborate with organizations as a coach, media trainer, public speaking consultant, and event producer. Karen's unique background led to her recruitment as the founding director of operations for a public charter school in New York City. And her tenure there inspired her to start a consultancy to coach and train school leaders and teams across New York City and New York State. She became a food allergy advocate after her daughter, now 21, was diagnosed with multiple food allergies as an infant. Take it away, Karen.
Thank you so much, Marie. Most important. Food allergy mom. So like everybody else, I got shot out of the cannon into this new world that I knew nothing about because 20 years ago, this isn't something we talked about. You know, really, we were all kind of in the dark. And if there's one thing that I can say that feels really important now is that we know where the weak spots are. We know where we need to get work done. And now we have a community really, truly to do it with. And so that's why I feel great about being here with everybody today. So I'm going to ask everybody on the panel to introduce themselves to start and to tell us just a little bit about how they came to work with FAIR. And we're going to specifically be talking about the intersection of food allergy and food insecurity and what effects that has on our physical and mental health. So I was going to say, go ahead, take it away, Amy.
Hi, everyone. I'm Amy Scarlock. I am a pediatric allergist and immunologist and a professor of pediatrics at University of Arkansas for Medical Sciences and Arkansas Children's Hospital. And I have been involved with FAIR for as long as I can remember, and even in its previous iterations. Our team has done research with FAIR and a lot of food allergy research, and have been connected through the advocacy and the research and that piece of it. And we're part of the FAIR Clinical Network. But I'm really excited to be part now of the FAIR Neighborhoods Initiative. We're one of the new sites. And I've gotten involved in this again because I think in Arkansas, food insecurity is a huge issue for us. Access to care is a huge issue. And it's really important to us as caregivers to partner and develop those connections to help improve the care and health outcomes for our patients and families.
Hi, I'm Linda Herbert. I'm a psychologist at Children's National here in DC with the Division of Allergy and Immunology. And in 2013, I joined that division and very quickly got involved with FAIR. I benefit from the fact that FAIR is right around the corner. So I remember lots of FAIR summits at the Gaylord and all these other locations. And really my role with FAIR has been to connect with families about the impacts of food allergy on mental health and to support families in figuring out ways that they can live a meaningful life that they want to live while also staying safe and feeling empowered to treat allergic reactions when they do occur. So it's been really fun for me to be a part of that. And then I was very fortunate that as the FAIR Neighborhoods Initiative was extended to include DC, that I was able to be involved with some of those discussions as well. So thank you to FAIR for having me today.
Good morning. My name is Jan De La Concepcion, and I'm from the Atlanta Community Food Bank. How we became partners with FAIR actually came from our nutrition and dietary department. They had already had a discussion or many discussions with FAIR, and because I work in food distribution specifically, the manager of the Learning Kitchen came to me and said, you might be interested in this. When I started my journey with the Atlanta Community Food Bank almost 8 years ago, it seemed really simple. Give everyone food, right? We took care of it. But throughout my food journey, I've discovered that it is much more complex, and we need to, from a diverse equity and inclusion perspective, we need to make sure that we are truly taking care of our neighbors. We're meeting them where they are, and that's across all levels. So that means, of course, dietary restrictions, allergens, and that's what we're working on now. Specifically, I support our community food centers. Those are standalone distribution centers. We've placed them in specific areas throughout the Atlanta area because we recognize that our partners cannot support the demand. We're doing about 10 million pounds of food a month. So I'm really grateful to be with you all today to learn even more, to take more ideas back, because we are just starting our journey. And also, I do want to talk to Ms. Wilson, because I see that we have someone there in Atlanta as well. We want to expand this, and we want to raise the level of knowledge and awareness throughout Georgia and throughout the Southeast.
Hi, I'm Nandi. My belly is Aisha. I have a 6-year-old. She always reminds me how she remembers being in my belly when she was unborn and how I didn't say anything about her. So I don't know how that is. She's like, Mommy, you never said my name when you was pregnant with me. I'm like, how do you even know that? So I'm gonna make sure that Aisha is not holding me accountable as well. So I have Aisha in my belly, and I'm Nandi. I am a parent. I also work for the CBCA as a community engagement specialist, focused on primary care and health equity. I also support a lot of organizations in DC with bringing people with lived experience to the table, which I feel like is very important. Just no matter what demographic you're from, no matter what area you're from, that's important for people to have the very authentic voice at the table, and create a sense of community. I always say, no matter who you are, a CEO, executive or leader or a cashier, like we all human. And I feel like when we come together and we learn empathy and we can connect one another, it creates like a ecosystem that I feel like we are meant to have within our world. I came to FAIR because I have food allergies. Mom Ava has food allergies, and just bringing my voice to the table, I felt like was very important for me, and just bring the perspective of, as a Black American woman, where in our community, food allergy really it exists, but it's like suppressed. So we're taught to suppress, like, hey, here, go take some Benadryl, you'll be all right. And so I bring the knowledge of just being unaware of food allergy, or it's not. We're so marginalized, like food allergy is something we will feel okay to suffer with. So that is where I come with
Thank you. I think, we're here today to talk about food allergy and food, insecurity and what that intersection looks like. And so, Nandi, because you are dealing at ground level at the DC Primary Care Association with, a lot of families who are in the situation like, that you have been, share what that actually looks like. What do you see when people are challenged by food insecurity at the same time that they're learning, or may not even know until later, what food allergy is and how it looks like? I mean, how does that show up in terms of what you see?
Yeah. So currently I'm working on a project because we are very limited on providers in DC. We just lost one of our major community health centers, which is Unity. And because of, I believe the young woman spoke about Medicaid. A lot of people have Medicaid that are in the communities that we support. And the hard part is, like, food allergy is not a part of the conversation because we don't have food access. So how can you talk about food allergy when you don't have access to food? So it's like things that they are unaware of. It's like, okay, I go to the food pantry, I have string beans, rice, bread, and macaroni and cheese. I'm already suppressed enough to believe that I don't have access to this food, so this food gives me a bad reaction. I just won't eat it. I'm used to not being able to eat food, so it's not hard for me to say I'm not going to eat this, but it's also even more mentally harder for you because it's like, I now have access to food. Like, this is my only access food with the food bank, especially if you're working within our community. a lot of people have this idea that we all have food stamps and housing because we're Black. And that's not the case. It's like majority, within our community, we are shamed for having food stamps and Medicaid or using government assistance. So a lot of people work 2 or 3 jobs. And when you work those 2 or 3 jobs, you can't get food stamps, or in some instances, you can't get Medicaid. So now people in our community are forcing themselves to suffer because the judgment of society is like, oh, Black people are poor, lazy people. And then the judgment of our Black community is like, oh, well, you're lazy if you don't do it. And we have this suppression from, I can say it, slavery, where our ancestors worked 24, 48, whatever hours they had to work. So we have this in our mentality that we don't really need to care for ourselves. All we need to do is work so that to make sure society sees us something. And so we don't have the time to really care about the food allergies or the disparities that we might have because we just suppress it. So it's hard to have the conversation regarding food allergies when we don't have access to food. And when you don't have access to food, now you have a mental health condition where you have PTSD, anxiety, and now you just walk around numb. And now we have all these things at the table that we have psychologists here, a food bank person here that it's like, I want to support, but how are they going to support if at the ground level people are suppressed?
So I want to ask Linda, you're working here in DC. What does this look like from your perspective as a medical provider? You're dealing with a population again where food allergy, isn't even a thing to some people, because if you can't access food, you can't be worried about it, or you may not have even had enough education to realize what's happening to you or the child.
Yeah, I think that one of the things that's really notable is that our providers don't really know how to talk about this with families. And so we try to communicate with our providers about how they can start to open up a conversation about food access concerns. And in our division, we have developed a health equity team, and one of our biggest priorities had been establishing a way to assess for food insecurity so that we can be the ones going in and asking that question, not relying on a family to even have to think about bringing that up, to have to think about, the emotions that may be a part of talking about their own experiences at home. And so we spent a lot of time thinking this through, because one of the things that I really care about and a lot of our providers care about is not asking a question and not having a response. So I really I feel distressed when I find out something from a family, but I'm unable to provide any type of action other than validation or saying, thank you for telling me. So in our division, we spent a lot of time raising funds so that when we ask families about food insecurity, we're able to then give them some type of resource. And I know that that is not necessarily a sustainable program. The families come and see us once, we're able to give them something, and then if they come back, we can give them more. But the challenge that we've had has been, how do we continue to collaborate with the community to make sure that when families leave our clinic, that we're able to continue to support them. I hear a lot of emotions from families about the experience of food insecurity. We make sure that we're asking them not just about access overall, but also allergen-specific foods. And we're really trying to make some efforts to connect with our community partners in that regard.
Amy, how does this look in your community?
So we have a patient population that we see at Arkansas Children's Hospital that primarily are Medicaid patients, have limited access. Unfortunately, Arkansas ranks typically number 1 or number 2 in rates of food insecurity nationwide, typically. So we estimate up to about 1 in 5 patients that come through our doors don't have enough food and don't have enough access to healthy food. So it's a huge issue in our community. And I think I would amplify the message about partnerships and connections, because that, no one can tackle this alone. It really is important to develop those community partnerships among our healthcare providers, our hospital system, and I would use an example of our literal neighborhood. So Arkansas Children's Hospital is positioned in the 12th Street corridor in Little Rock. And if you go one direction, you've got Little Rock Central High School, which is a key part of the civil rights movement. And then on the other side, we have, Philander Smith University, which is, an HBCU that is just down the street from our, hospital, and has actually been a very dedicated community partner. We have actually had our community engagement team partner with the food pantry at Philander Smith to allow our patients to come there and provide allergen-free food. So we're literally, as we talk about neighborhoods, we're literally working in our neighborhood to be good neighbors there, in addition to working statewide. But it's a huge issue, and we actually recently published a review article that includes some of the people in this room as authors, just talking about how it takes multiple stakeholders to address this issue. It's not just the physicians or just the nurses or just the people who work in the food bank or the psychologists. It takes a multidisciplinary, community-based approach to address these issues.
I mean, you've heard from, the patient and caregiver perspective. You all are giving like some medical texture to it, thinking, Jan, you work for a very large food bank operation, but I would imagine that when you started, you weren't thinking about this intersection. I mean, how did you figure out what the need was and then figure out how to address it?
So when I first started it, regardless of what my title was, I would explain to them what I do, right? I actually have changed that over the years. I've been with the Atlanta Community Food Bank almost 8 years. Now I fight for food justice because I've discovered that in the beginning it was we give people food. Great. They're taken care of. Yay. We've done our part. And then over the years, I've watched it change, and it's become, for me personally, very, very complex. And so at the Atlanta Community Food Bank, we have to every day stop and ask ourselves, what are we doing to meet our neighbors where they are? How do we elevate them and lift them up? At the food bank, in addition to, and I alluded to earlier, we have our community food centers. That's one way. We also recognized, and it's something that I've said many times to my coworkers, when a person comes to us and they are food insecure, they probably also qualify for additional benefits. So we should also be supplementing that one piece of their coming and picking up food with what else do you qualify? At the Atlanta Community Food Bank, we support multiple government programs, TFAP, GNAP, SNAP, so that, again, it isn't just coming and getting food. When our neighbors need food, we might give them food that might last them a week, a couple of days, maybe several weeks. But what are we doing in between? So for us, we think about that. How do we support them? But from a dietary restriction and an allergen standpoint, one of the things that we do consciously in our 355,000 square foot warehouse is we segregate food. We need to make sure that the food is safe and that there is no cross-contamination. That's really, really critical. When we work with our volunteers, we saw, I think, probably close to 30,000 volunteers so far. When we work with them, we say, one of the first things we say is, do you have any food allergies? We don't want to put them at risk either. But again, it helps us think. That should be in the forefront. In addition to that, when we screen our neighbors, when we're creating their accounts, one of the things, we have a whole section and we specifically ask them, do you have any specific dietary restrictions? Do you have any food allergies? That really helps us in terms of procurement when we're sourcing and we're selecting and we're bringing in food, whether it's donated or purchasing it. It also will provide us the data. It gives us the metrics and an analysis to say, in this area of town, we're seeing a lot of X, Y, and Z. So we want to also look at it from that perspective so that we once again are supporting our neighbors. And last, and probably one of the most important things that I have initiated at the food bank is trauma-informed compassion care. Because I realize that our neighbors, when they come to us, it isn't just again about giving them food. We alleviated that stress. So now we're teaching all of our food bankers and our volunteers how to recognize signs of trauma, how to support them, how to make them feel welcome, to give them voice and choice, and to treat them with dignity and respect. that's really, really critical for us. The one thing I'm getting teased about in Feeding America, which is the national network of food banks, we have over 200 in the United States. When I started developing this training, I thought, who else has this? So I put a post on Yammer. It was really innocent. It was a month ago. People keep calling me and saying, you broke Yammer. You've broken Yammer. I received over 24, almost 36 responses from other food bank sisters in the network. Here's what we're doing. Here's what we're doing. Then I innocently said, I'll be happy to share this resource I've been sending out over and over and over again. But the other part that it really surprised me was to see that almost 900 people in our food bank network said, this is something we need in order to properly support our neighbors. So again, this is so complex. I guess when I look around this room, we're all fighting for food justice. It's so important that we take care of our neighbors. That's how we refer to them, or a community. A community is a place, but it's people.
Nadia, I want to ask you to speak to this because we've talked a little bit about what kinds of efforts you see that might be working. And I know you've talked about, like specific programs. What do you see? Jan is describing a successful effort that is helping, that's involving getting food directly to people. What do you see here that's helpful?
I would say thus far, what I find is helpful is what, Jan has spoke about is the trauma-informed care. I feel like when it comes to, food allergy and even just health equity, it's a lot of trauma that comes with it. You will, find that you will go to appointments and it's like 20 minutes long because you have Medicaid or the staff is like overwhelmed. And like I've seen, like even with children's, like my daughter goes to children's, and I couldn't really my provider. It's like I have to wait like 2-3 months to see my provider under Medicaid. But with my daughter's children's appointment, they ask me questions about my health and what's needed and what support. And like one time when we did have when I wasn't working and I couldn't afford food, they had the Flip RX program that was really helpful. It's like it was from local farms, fresh food that came to you. I think it's about bi-weekly. It was bi-weekly that it came. So those type of things was very helpful. Was like less on me to go drive somewhere because the food banks is from 9 to 11 or like 2 to 3. If I'm in the situation where I'm working or if I'm not working or if I don't have transportation, it's not so simple to just go. And sometimes those bags are heavy. Like, who wants to carry a 5-pound bag of potatoes on the bus? Like, I don't have. Yeah. It's really, so those, when it comes to programs, but the most important part for me when it comes to, when I speak at engagements, when it comes to health equity or any type of equity, is when it's like, look at yourself and practice empathy. I see the world in a very, my mother says a very strange way. But you see, like the happiest people are the ones that go hiking because you can really step away from the world. You can. I mean, you can, because you see, I'm full on my faith in my creator and how this world is created. You go to the forest and then you go to see a garden. It needs no human interaction. Like it's just a whole ecosystem. Like it's just thriving. No human interaction, no, because it was just created to do that. And I believe us as humans, we all have our individual selves that's like created to do a certain thing. And we was all born to be able to, like Jan said, to support our neighbors. So we all have the mindset where I'm not born to only satisfy myself and my immediate family. I'm also born to support everyone else. Like I always say, like I wonder if the bee knows that when it goes against the honey for its own colony, I think it's a colony, whatever. But when the bee goes and gets the honey, the nectar, to go back and take it to its family, doesn't know that it's helping that garden thrive. Doesn't know like each flower it goes to is helping the garden pollinate and create a community, larger garden community for that garden. So when I tell people to just put like a sticker and just imagine like, who are you in that garden? Like, are you a bee? Like, are you the type of person that's able to help do you have that resource to like change environments and support each person that you walk to or you're close to? Or are you a flower? Like flowers have medical properties. We'll be using some of our medications. Like who are you? What is your gift, your unique asset that you have that you could support the next person to help this community thrive? Because if we don't have that mindset, if we don't get to a point where the president, the senators, the local people, the leadership, the CEOs don't have the mindset of empathy of how I can help others sustain, it's like, this is why we're in global warming now. Like nobody cares about taking a shower 5 minutes later, 5 minutes less. I mean,
I want to stop you there for a second, Nandi, because you raised so many important points. And when you're thinking about, like, you know, we all chuckled at the hiking comment, but if you want to go hiking, you better have some energy in the tank.
Mm-hmm.
You need to be healthy to get out and walk.
Yeah.
And so what comes to mind immediately is the food is medicine, movement.
Mm-hmm.
And the idea that you talk about the ability of being able to get fresh food being hugely important to food allergy families. So I'm going to ask Amy and Linda to weigh in from the medical perspective of how that is shaping up for our community and what you see that is working and where we might be challenged there.
I'll go ahead. So I'm a big fan of the food is medicine movement. And, I think this is a huge, next step. I come from a background of people who had farms and grew their own food. And so I think it's so important for us to think about, as Nandi was saying, the bigger system and how we all intersect and all that piece. But I really think the food is medicine approaches, have so much potential for our patients, for our families, for our communities, for our neighborhoods, for all of us. Some specific things that we've been working on are related, obviously, to food access and access to healthy foods, whether that's through food banks, through food RX programs, through community gardens, some of those neighborhood initiatives. We're also, food as medicine can mean prevention. In food allergy, we know a lot about prevention, so we may need to think about how food as medicine can be used to prevent food allergy. So moving back in the timeline, so to speak. I'm also a part of our culinary medicine teaching kitchen. And so this is an evidence-based approach to healthcare. And it can be addressing cardiovascular care, it can diabetes, but we also have an interest in adapting this to food allergy. And we already have been out in our communities doing pop-up teaching kitchens using allergen-free foods. Would like to really expand that to really think about ways to kind of meet people where they are and, show them that, there are really great ways to use these fresh fruits from the community garden. And then here are some spices that can really zhuzh this up and make it really yummy. And so really just trying to, again, meet people where they are, in those communities. And, and I want to also amplify the message about thinking about the bigger picture. Like for us, I think, the food is one component of it, and food is certainly the heart of good health, the heart of nutrition, the heart, all those things. But we've got to think about the bigger picture because the food insecurity is almost a symptom, if you will, of a bigger picture of trauma, of redlining, of other systemic issues that have, systemic racism, all of those things that have been a problem. So I really want to amplify that message about thinking about the bigger picture as well. So, and I will let Linda talk now.
Yeah. All day. So when I think about food as medicine, of course, I'm thinking about it from a psychologist perspective in that food is the basis for all of the things that allow us to enjoy life, right? So if we are having healthy nourishment, our kids can pay attention in school better, they can learn, they can sleep better, they can engage with their world better. And so beyond just food allergy, food is that basis for all of this. And we want to raise and elevate all of our communities by giving them this food access. I think the other piece of this, and I love that you're thinking holistically, is that I think that food as medicine also translates to food in our culture and our cultural events. And so when I think about my connection to my community, I'm thinking about the events I go to where there are food trucks. I'm thinking about cooking with my family. I'm thinking about all the really meaningful events that are important in my life. And so I think that giving kids access to healthy foods, to safe foods, is also giving them access to engaging with their community in the social way that's important to them. And so a lot of the conversations that I have with families in clinic is about how can we move towards living what is meaningful to you, what you value. How can we celebrate the parts of your culture that are really important to you while also navigating and managing food allergy? Because there are ways to do both, and sometimes it can feel like there aren't. So I love hearing about what foods are important to families, how they're cooking them, how they're working together, and how we can embrace the spirit of whatever that social event is, even if it looks a little bit different than what it may have looked like in your mind before you knew that you were also managing food allergy.
Before you give up the microphone, I don't know if this is working or not. I wanted to know what Nandi was talking about is this numbness. And what you're talking about is beautiful, but how do you get through the numbness to have that beautiful conversation? And I know how I do it in my practice, but I'm not a psychologist though. So I'd love to hear from your standpoint of how do you get to that beautiful conversation?
So a lot of times I don't start by talking about food allergy with families. I start with talking about what's important to them. Who lives with you? Where have you gone recently? What school are you attending? What are some of the fun things that you've done? What's important to you? What extracurriculars are you engaging in? Oh, you love figure skating. That's wonderful. What does that look like for you? And so I think that by seeing the whole person before you sometimes narrow in on the food allergy, that gives you some insight. And it also is communicating to families that you care and you want to know about those things. And people really do get emotional during these moments, and you can kind of see like the thawing that can occur. But the thing is that takes time, right? And that takes intentionality. And I think that's what's really hard in our really fast-paced medical community is like finding that time and that space. And so sometimes, it really is me as a psychologist being that adjunct for our medical team. And just on Monday, I had a parent in an oral food challenge who I pulled her aside and we talked for like 20 minutes. And at the end of it, she was telling me, she's like, I've just never had the space to do this and to process this. And so even in those really fast-paced medical appointments, if there is space to have at least the feeling that things are slowing down, to have that feeling that you're looking more holistically at the family, there's so much value to that. And I'm guessing that's what's happening, Andrea, like when you're going to schools, it's like you're having those conversations, you're seeing these bright, energetic kids that are doing so much more than just talking to you about skin prick tests.
Oh, yeah. That's exactly what it is. So, seeing that child for who they are, and then I can figure out like why they're having reactions at school. I can go, okay, what really is happening is the food that you described that you got from the food bank is absolutely not okay. But how do I know what you're picking up from the food bank or what's available if no one tells me? So I need to know that information. But in order to get to that information, people have to feel comfortable and loved. And once they are, they can tell me. And I can go, okay, well, I can get the Chicago Public Schools nutritionist to give me every single food that they serve and what's in there. And I can find out why they're reacting to that chicken or why they're reacting to who knows what. Mm-hmm. And then give them a list of foods that's available that's safe. Or talking about what is available at the food pantry, what have you got, what have you reacted to, what is there. And yet I hear the positives like, oh, I got this cut of meat because I went on a Tuesday or whatever. I don't know what that comes in. But like, I get to hear these beautiful stories about what they made with the food bank and how they made it. And then I can say that to another person,
Well, you gave us a great transition because I know Amber's going to hold me accountable somewhere. We are running out of time. I would like to leave people with something that I think is actually a really hopeful thing. And Jen, if you would talk about the fact you mentioned when we spoke, the importance of being a food bank that collaborates with FAIR. You talked about what the Teal Pumpkin Project did, for the folks you're working with and the folks that you serve. And a reminder that we should be able to associate food with joy also.
So last year, I do all of these other things at the food bank. I'm also the wellness team leader. So to me, it's important that in order for us to take care of our neighbors, we need to be healthy and well. And so last year, when everyone wants to put out candy, I said, y'all can have your candy, but I wanted to offer alternative healthy snacks. So we did that. but it also allowed me the opportunity to introduce the Teal Pumpkin Project. So we put pumpkins around the teal pumpkins. I went and bought the buckets. We put them all around the food bank. We talked about it. We put up posters. So people were saying, what is this? I saw many people say, oh, this is perfect. I want to take this home to my child. Maybe it was also because they didn't want them to have candy, but it was, people were like, wow, this is amazing. So this year I've upped the ante. It is now I want food bankers to take home. I went and got even more teal pumpkins, and Amazon doesn't have stickers, glow, ring. I've got it all. Because I want them to take it home, and I want them to also share it. So I told them, I've been pointing out the map. We've been introducing the information in our newsletters. And of course, when we do our Halloween day, we're going to have them out. We also have it at our front desk. So everyone who comes in and says, what is this? We have the opportunity to be able to share it with them, little flyers, the information. So for us, again, as you've mentioned, but we also have to have an awareness and have to have that knowledge. I did want to say too that we've embarked on, and we've been doing it for about 5 years. We also have a food as medicine program because it's so important. Last year we distributed 62 million pounds of perishable food as opposed to shelf stable. It's not you got your box of canned goods. It's what else can we give you that's healthy and nutritious, because you may not have the money to purchase that in the grocery stores. So we want to help our neighbors in every way possible. And I have to say, I'm just so grateful because I'm going to take a lot more information back to start even more initiatives at the Atlantic.
You should talk.
So, we have time for questions and answers. I know in this room there are some questions.
Oh, I'm shocked. Seriously?
That plug is not slide up. Sorry, hold on.
Mm-hmm.
And my readers.
Can you speak more about the mental health implications of managing food allergies in underserved communities? Linda.
Yep.
Yeah. So we know, of course, that food allergy has a significant impact on mental health, regardless of your background, or your identity. But certainly in our families that have less access to resources, this is even more challenging. And I talk a lot about, we have this kind of in psychology, we have what's called the Maslow hierarchy of needs. And as you can't get to self-actualization if you don't have other needs that are met, like safety, like access to food, having our institutions supporting us. And so I think that when we work with families in our DC community, we really have to be thinking about all these different layers here. And so a lot of times what I'm talking with families about isn't necessarily about the impact of food allergy on mental health. It's all those other things that Namdi was mentioning. And so we cannot just have a narrow focus on food allergy. That being said, we need communities that are aware of food allergy across the various settings in which kids interact. And one of the things we haven't necessarily touched on right now, but I think is important, is the initiatives within libraries and schools. So, Andrea was mentioning bullying and food allergy. We know that about a third of kids are bullied for their food allergy at some point. My patients routinely tell me about situations where they're threatened, where they're told, one day I'm going to kill you with your allergy, really terrible things. And so I love the initiative where we're working to bring more education into the schools. I love that, I'm hearing that there are libraries that are starting to just have books about food allergy that are just happen to be in the library that you can check out. And it's not a specific food allergy program, but it's here they are. This is just something you're going to find in your community. And I have a 7-year-old daughter myself. She does not have a food allergy. She knows how to use an Epi auto-injector trainer, and she tells me about all of the kids in her class and reminds me, I am the one sending lunch to her. And sometimes she'll say, remember, we're having a party and my friend, he has a peanut allergy, so we're not bringing any peanut snacks. I'm like, great. So I think that when we are building a community that knows about food allergy, that normalizes it, that shows you can have fun regardless, when we can include kids, that actually is bolstering the mental health of all of our patients that have food allergy.
I have a related question, which is, the caregivers, the amount of stress that food allergy caregivers are supporting is overwhelming. And so what kind of resources are available, or what kinds of things do you want to see develop that address that directly.
I could spend a lot of time on that.
I bet.
Yeah, I mean, there's so many layers. All right, there are many, many layers. One is having access to educational resources that help you normalize the experience, that give you information about how do I tell the difference between anxiety and allergic reactions? What do I do if my kid isn't quite sure what's happening? Having access to mental health providers who have food allergy experience, both within these tertiary care centers, but also within the community. Having available things in beyond English, right? So I admit I am only fluent in English. I would wish that I was fluent in other languages so I could be providing mental health services to other families, but we need to have resources that are available in multiple languages. I can tell you there's a couple of things that I'm heavily involved in. One is the pipeline. So we have a Society of Pediatric Psychology that brings on, has all the graduate students who are getting training in clinical psychology. And we have an allergic diseases special interest group where these people get to learn, and we're recruiting them. We're bringing them to our side, which is really fun. And so we're training them so that when everyone in the community tells us there aren't enough of you, we can say, okay, we're trying, we're making more. And then also, I'm involved with a more global initiative where we're trying to develop an online intervention that could be given to any family so that they could be accessing resources to help themselves. They wouldn't have to be seen by an allergist to get access to it. So I'm all over the place, Karen. There's so many layers that exist.
We'll come up and ask you questions later, I guarantee.
And I would amplify, just so much of what you're doing in here with FAIR. I mean, the things she listed are things that FAIR's doing. And I think that's really cool to know that you're making such a meaningful impact, not just thinking about food as fuel or food as, just food, but food in the culture of food in our mental health. Food is as joy, right? So food is joy. And, and you mentioned a hierarchy of needs, and I had made that note as well, because we want to get everyone to that self-actualization, not just meeting basic needs.
There was one question that came in. Oh, see your hand. I have one, a live one.
Thank you. My name is Levine Gill. So I have a question for what I heard in opening from the physicians. Is what are we doing in medical education, in medical schools for across the board for educating physicians about these allergies, regardless of specialty? Is there a missing link there?
I think that's such a great question. And you're hitting on one of my love languages, I guess, about wanting to teach and empower our physicians, providers, nurses of all types. Certainly we have food allergy education in our curriculum, but as you all know, anyone who's in medicine knows, our nutrition and dietetics education is very limited. And so I can speak to one specific example we're doing in our culinary medicine kitchen. We actually have teaching kitchens where we bring in medical students, pharmacy students, nursing students. They actually have it integrated into what's called the IPE, interprofessional education piece of our medical school curriculum, where they're coming to learn about food allergy and intolerance as part of those modules in that elective. But, as you know, they also have to learn about heart disease and healthy diets and all that. So it is a big need, but I think there is definitely a continued need and certainly a disconnect that I hope we can start to bridge that gap and improve that education. The AAP also has a lot of resources. They have what's called there's, for example, a toolkit for pediatricians in screening for food insecurity, recommending universal screening. There's other toolkits through other professional organizations, Quad AI, the college as well. But I think that's a really important need we need to continue to address.
The answer very simply, there's not enough.
Not enough.
There's not a lot of allergists, and there's not a lot of allergists in academic centers where the medical schools are teaching centers, and we're outpatient, right? So when their predominant medical education is inpatient, which we need. If I'm in the ICU, I want them to know how to take care of me, right? But they're not getting enough of how do you take care of people on a day-to-day basis and as an outpatient. So you come in and you're thrust into it. You have to learn that. I teach that to my new faculty. But then I have to go, and I went to American Academy of Pediatrics just last to teach pediatricians how to do this, but that's too late. Mm-hmm. And the other piece of it is you could teach about food allergy, but if you have no context of the nutritional aspects of what you do, like food allergy nutrition is so quick. I don't recall any of it. I had to learn that myself as an allergist to say, how can I get my patients what they need when they have a food allergy to milk or whatever? How can I get them safely the protein intake they need or whatever else they need? And that is a lack of education that I think if we could come together to attend to infiltrate the medical school curriculum would be amazing. If not, we have to do it individually as their pediatric and internists and family practitioners.
And we're sure working on it.
I'm going to ask that question because of the personal I have a daughter who has severe food allergy. She's now in medical school, and I thought at least in medical school they would be more aware.
Yeah, it varies.
Not at all. She had a huge issue, right?
Yeah.
During the classes where they were putting out food. So that was like, oh God.
Yeah, it is. So it's a huge gap. It's a huge gap. We're certainly working on some ways to bridge it, but it's a huge gap for sure.
How to use an epinephrine auto-injector.
Yeah.
Physicians don't all know how to do this. I mean, and I'm not trying to say this to be mean to my colleagues. It's a gap that needs to be filled. And it's an outpatient issue. And so that's, again, bringing outpatient medicine into the forefront. And what that means from a day-to-day, if we don't start with the food that we eat, we're never going to get anywhere. This is why we have chronic disease, right? I mean, so there we go.
Yeah. I'm going to stop you, Andrea, because as I knew Amber would come and get us. The last thing I want to say, thank you all for your rapt attention. Consider this a call to action. We're all collaborators here. Think about, we talked about there are many things we've done that are amazing, that are wonderful. We are so much further along than we were, but we still don't have enough education. We don't have enough resources. We don't have enough support. How can you personally collaborate with some of the people you hear speaking today and offer something that they might not have had access to before? Thank you.
Thank you.